Thanks again for everybody joining us. And one last thing I failed to mention, the whole idea is to have this to be a very interactive, beneficial, provocative discussion all day long. But the other thing you'll notice, this first panel, we do not have a moderator. So the idea is to give everybody a little heads up, is we're gonna start off with one or two topics. And then from that point, we want to get in and just kick it out to the audience, because I think that's the one thing that's going to be most informative for you guys, and certainly I think for us. So Bob, do you want to kick things off on an introduction of yourself?
Sure. Good morning, everybody. My name is Bob Hoban. I'm an attorney and an advisor. I run the Global Cannabis division for Clark Hill, an international law firm. I also own a company called Gateway Proven Strategies, a leading global consultancy, and a company called C-Trust, which is the only credit rating system for businesses in the cannabis industry. It's a pleasure to be here. One quick note, two quick notes. The concept of THC plus and minus, I really, really love this concept, and I hope that you can get your minds around that today, because this is not about selling flower. It's not about just selling vape cartridges with high concentrations of THC. And sometimes in different parts of the world, we get caught in that little silo where we believe the industry is what we think it is. But it's far broader than that, and we have to embrace that concept, because whether we like Delta 8, so forth and so on, it's the same sandbox. And also, David, you saved me in Davos. By the way, when you go to, if you ever gone to the World Economic Forum in Switzerland, it's a ghost town during this event, because everybody flies in and out. So I drive into this town and I can't find anything or anybody except for this friendly face who helped me find where I was going. So thank you for that, David. You saved me. You saved me. Jamie.
Good morning, everybody. My name's Jamie Pearson. I am the president and founder of New Holland Group, which is an international cannabis consultancy. I spent 7 years prior to that running a company called Bang Inc., which was famous for its cannabis-infused chocolate, which when I started that company, or started working for that company, we were in California. When I left, we were in 7 US states. We were the #1, 2, and 6 chocolate in Canada, and I brought our CBD products into 9 European countries. So I've been in the industry a long time, and my dad has been growing 56 years, so I grew up knowing how to look at trichomes and how to trim weed, whether I wanted to or not. And my cousin on my mom's side is DJ Muggs from Cypress Hill. So when I was in law school in 1992, my cousin lit a joint on Saturday Night Live. So I've been in the industry in one form or fashion pretty much all my life.
Good morning, everyone. I'm Rob McAvoy. I'm president of the McAvoy Management Group, which is a consulting firm to the cannabis space. Prior to starting my company, I was an owner-operator across multiple states in the United States. Formerly, I was a VP at a cannabis ag tech company that was NASDAQ listed. So a lot of global cannabis experience in formulation, cultivation, extraction, retailing. Been doing this now for over a decade in the commercial space. I've been on the supply and demand side of cannabis since I was about 14, 15 years old, though. So really looking forward to the conversation this morning and keeping it lively.
Thanks, Rob. So as you guys know, the title of this panel is to essentially look back on the past. And so the first topic we'd like to at least start out with the panelists is looking at adult use and medical cannabis, both here in the US, all over the world, has been treated differently or dealt with differently. What does that mean historically? How's that happened? How's the treatment been different, and what are the implications for the future? So ladies first. Jamie, do you want to?
Absolutely. I think watching what's happening in Europe, I'm going to start, how did we get here? Where we are right now is Germany, and how did we get here? We go back historically and see what happened in California in the Prop 215, which was a, let's put medical program in air quotes, which basically was a way for people to go get cards and get cannabis so that they didn't have to worry about going to jail. And then the industry sort of blew up from there. But where we are now in Germany, it is a true medical program. This is in Germany, pharmaceuticals. It's going through the Apotheke, it's going with a prescription, and if you know what you're doing, you can actually have the government reimburse you. That's a far cry from what we saw in California so many years ago. And then there's everything in between. The other thing we're seeing on that THC plus and THC minus conversation is the explosion of hemp-derived products that are getting people high. And they're, quote, legal THC. And we're also seeing in Europe that there are places that are figuring out, oh, well, I can spray terpenes on my hemp flower and I can get people high. We're gonna get to the same result. The reality is human beings want this plant. That's where we are, is that now as you have more and more people waking up with access to the plant, you cannot put the genie back in the bottle. So now it's not a matter of if cannabis is going to be legalized worldwide, it's a matter of when and how, and these are the rooms where we're going to shape that conversation.
So in Colorado, back in 2009, 2010, we had a lot of medical marijuana migrants. With Charlotte's Web coming online, we started seeing a lot more firms bringing patients with very high needs into the state to gain access. At the same time, we started seeing other medical marijuana programs open up in Illinois and in Maryland that started to require or wanted to ask for a pharmacist involvement to bring in more of that medicinal check and balance as it relates to the products, as it relates to the potencies, and then of course their therapeutic effects. That got a lot of backlash and resistance in the program itself, because what we really have is a culture versus a commercialization clash. And there are a lot of legacy folks from the cannabis space who did not want medical professionals coming in those capacities. And so with that, we started to see the evolution of more and more municipalities at a local level in the states open up and create more of that over-the-counter access through adult use programs. And of course, then that started to mitigate and decrease canna-tourism, if you will, for patients and the migration of those patients into the programs. I think now when we start to look at where it's going into the future as it relates to cannaceuticals, there's a very big opportunity gap because as we've been talking about, we're really looking at a molecular and a phytocompound basis. We're looking at active pharmaceutical ingredients. And so with that and having a cache of those ingredients, we can formulate new products, we can formulate new delivery systems, and of course, new product formats. So I think that as we continue to start to see the European market opening up, going through the pharmacies, going through the extemporaneous compounding process of different methods of delivery, we're really starting to see more of an emphasis on a strain to symptom and on a condition to compound approach.
It's important to know that every country around the world legalizes cannabis for a different reason. You have to understand the quote-unquote why. Why did they legalize cannabis? Was it because of medical reasons? Was it because of criminal justice reform? Was it for social justice reform? Was it for economic development? This is the very cornerstone that you have to understand as an investor or operator in this space, because if you don't, you have no chance of participating in that region, that jurisdiction's marketplace. For example, medical, quote unquote, using that notion, medical marijuana in the United States has nothing to do with medicine. Medical marijuana means this is how you qualify a purchaser. They have a condition that a doctor has recognized. It's on a list of conditions, and that allows that purchaser to legally walk into a store, possess, cultivate, or purchase a cannabis product. Nothing to do with medicine, nothing. Very different in Europe, very different in Germany. As you mentioned, it's a pharmaceutical model. And here's the notion that I can't wrap my mind around. The notion that in Europe, flower can be prescribed as a part of a medical regime, as a medical solution. Never in the United States, ever is the FDA going to sanction a program where doctors recommend a flower. No, it's always going to be an extract and a formulation. So to have these models merge in the future is going to be really, really interesting. And again, I don't doubt the efficacy of cannabis for a second. That's not what I'm saying. But in the United States, medical marijuana merely qualifies the purchaser. The last thing I'll note is it is important to recognize that the sandbox, so to speak, is not just about flower. And I've argued that industrial hemp really is the backbone for the cannabis supply chain. The entire global supply chain in the world can be built from extracts from the hemp plant. It costs $600 per acre to grow. It's less regulated. And guess what? It contains the exact same cannabinoids, just in different ratios, as a high concentration marijuana plant. So then why would you go through the system of registering a medical program, going through millions and millions and millions of dollars of infrastructure development, when you can grow it for $600 per acre, extract the compounds, and create formulations based thereon? That is the future. And the more that we recognize that, the faster we recognize that, and you may not agree with this, but this is a fact. I mean, this is the way the supply chain is going to develop globally. The more that you can get your mind around that, I think the better positioned you'll be as an investor, as an operator, to work in this industry.
Thanks, Bob. Two things maybe to bring up real quick. That's looking at the past, the adult use versus medical. One, if you know about Oklahoma, is crazy, right? So Oklahoma is a medical, quote unquote, medical market, right? And the first year, I think, second year, they had $800 million in sales in Oklahoma. And anybody that knows Oklahoma realizes they don't have that many people smoking pot, frankly, right? And it's meant to be a medical state, and most of that stuff's probably going down to Dallas, Texas, right? So here's this medical market that's actually more adult use, right? And then on the other hand, if you know about the recent weed care program in Switzerland, if you don't, you should know about it, because it's, I think, gonna be probably the model of the future. So here you have the weed care program in Switzerland, which is an adult use program where they roll it out in specific cities associated with a given university, and it's under the Federal Office of Public Health in Switzerland, but also under the auspices of the UN Narcotics Board, which is a big part of, if you know, the UN Single Convention of 61. So here's a adult use market that's actually being rolled out like a medical market, and I think that's hopefully maybe going to be the model that works in the future, because I think, as everybody here on the stage will agree, one of the big things we need to overcome is the stigma, and the stigma needs to be overcome by information, intellect, data, and just a clear path forward.
And medical studies. I mean, I think at the end of the day, we put air quotes around medical program, but I think the reason cannabis is so popular is that it actually works. And it works, you know, from my perspective, having run a chocolate company, a lot of people would not read the instructions, and they would eat the chocolate bar that had, you know, anywhere from 100 to 420 milligrams of cannabis. And if you ate the whole chocolate bar, you might end up in the emergency room with a panic attack, but you wouldn't die. At the same time, you're doing that because you're seeking some relief, whether it's the ability to sleep, or it's pain, or it's nausea from taking chemotherapy, whatever it is, Parkinson's, you've got some sort of a seizure disorder. People are seeking relief because the pharmaceutical industry is limited from the compounds that they're providing, whether they're opiates or whatever they are, and our body has an endocannabinoid system, and we actually need this medicine. And so I read a statistic, and it varies depending on who's doing the study, but approximately 85% of all people using cannabis in the adult use markets are using it for some medical reason. That's why I know this industry is not going away, because people want this access to this plant. So to Bob's point, if we figure out the most efficacious way to deliver it to them, where we can, as business operators, have banking, have marketing, and get people access to this plant in a way that we can actually make money, it sort of becomes a snowball effect, because we can get rid of the stigma. The more people that have a great experience with it, where they don't end up in the emergency room, where they end up sleeping through the night, they tell 10 of their friends, then they try the gummy, or they try the chocolate, or they try the vape. And right now, it's a global phenomenon. It is an actual industry, and in our lifetime, I think the only other industry that's blown up to this degree has been .com. Maybe Web3 is coming, but we are creating jobs, we're creating economic development in a time where we desperately need it. So I think there's a lot of factors figuring into this. The only thing that we're fighting is fear. The governments are afraid, and I suspect that fear is coming from industry that is challenged by this plant. So it's alcohol, it's tobacco, it's pharmaceuticals, because they're wondering, well, what's going to happen when everybody has access to cannabis? They're not going to be taking opiates, they're not going to be taking Lyrica, they're not going to be, drinking as much alcohol, and it's actually playing out to be the case. So we're a dangerous industry in the sense that human beings are going to be using this in higher percentages.
Just really quick, just a quick note, giving people access to whatever way they want to access cannabis is important, because over-the-counter cannabis, when I walk to a dispensary, I buy a flower or an oil. That's one way to access it, but it's a whole other way to go to a doctor and get a prescribed medication or a formulation that's gone through clinical trials and is registered. But all of those things need to be accessible. But that's your point, David, is this is moving towards the pharmaceutical model, which is the latter. No one's walking into a dispensary necessarily in conjunction with their doctor. They're going and getting a formulation, and that's how you have to widen your perspective and realize that patients need to have access as many different ways as possible, even if it's not a specific prescribed medical use.
I completely agree, Jamie and Bob, and I think it has to be mentioned that there's an onus on the operators in the program as well, no matter where they're operating. They need to understand what problem they're trying to solve and why they're trying to solve it in order to be able to create the physician campaigns, in order to be able to create the patient messaging that closes the communication gap between how this might be valuable and from there what benefits it's going to have for whatever malady we're trying to treat. And so a lot of operators are running before they're crawling and walking. And with that model, they're not slowing their scale to their sales, and now the priority is shifting in their business model and how they're executing on their business plan. And with that, patients and physicians get left behind, let alone the regulators who are still trying to understand all of the different nuances of this plant and the derivative products that come from it.
Well, I was just going to say, we're in prohibition right now. So if you study history, at the end of prohibition of alcohol, there was a lot of, I would say, danger. A lot of people rushing to get where they wanted to be or to make that cash grab. The interesting thing about this industry is it's both medical and it's recreational, in the sense that people use it as a social lubricant as well. And so, when we're looking at all of that, is it a plant? Is it CPG? Is it medicine? It's all of those things. And so what we haven't figured out yet as an industry is, where do we land? Where is it going to be where are we going to be able to give people access the way they want it?
So I'd like to kick it out to the audience. Any questions? Somebody want to kick it off?
Let's hear it from the panel. Let's hear it first. Does anyone have a question? Just raise your hand. I'm wearing comfortable shoes. We'll be fine. All right, here we go.
Thanks for that, guys. Is that close enough? My question is, what has gone really wrong in the industry that's set us back, and how can we learn from that, and how does that project us forward?
It's pretty easy.
Yeah, no, that's the start of a 10.
Well, so
We don't have time for that question.
No, but
Sorry.
listen, I appreciate that, but if you could pinpoint a few key things that you think have been really painful and maybe set us back a little bit, but actually in the long run will take us further. Maybe if you can use that frame.
The easy one, and this goes across all kinds of geographies: too much arrogance and too little humility. So essentially, you have all these people that jumped in, thought that it was going to be easy, growing weeds easy, growing really good weeds not. Then you had, the Constellation deal, $5 billion put in, and you essentially had Canopy Growth put in 2018, early 2018, they bought a facility in Lesotho, South Africa, or Lesotho, 28.8 million. They sold it less than 2 years later for who knows how much, right?
To the people that sold it to them, by the way.
Yeah, exactly, totally. Yeah. And the fact that you essentially have these people that think everything's going to be, for example, one last thing, and I brought this up when Bob and I were in Davos. The one thing that's been a huge advantage for my firm is the fact I understood that biological supply chains are inherently unstable. When I was doing recombinant protein production in the early 90s, we scaled up from like 300 to 500 liters. And all of a sudden, this protein impurity, we're making phase 1 material, this protein impurity came out of nowhere. And we had to figure out a way to get rid of it. And having that experience, and you're watching canopy growth and Aurora and all these harvests go from like 40,000 square feet to grow to 400,000 about 5-10 years ago. And guess what? We're like, well, that's going to effing blow up. And what happened, right? So that's just a real classic example. I'll kick it over to my colleagues.
I would say the problem in the industry is that the types of consumers that you want to walk into a store and buy cannabis don't go to stores because they grow their own or because the laws are so flexible that higher quality cannabis is grown in smaller batches and you can go access cannabis from people you know versus walking into a store. I hate alcohol analogies, but I would suggest that the person that goes in and buys a case of beer or a $14 six-pack of beer every couple of days, that consumer is not prevalent in the cannabis industry. That's my perspective. I don't know, Jamie, you lived and breathed it.
I would say it's misinformation, and part of that comes from the lack of testing that university testing, lab testing. So we have consumers that are buying indica, sativa, and we know that indica and sativa is really talking about the shape of the leaf of the plant and how it grows, but it's kind of telling people, I might be indica couch, I might be sativa feeling up, but the reality is we all in the industry know it's terpene profile, but we don't test for terpenes, and oh my gosh, we can't even start there because we don't have banking, we don't have advertising. What's gone wrong? We're in our infancy, right? All we can do right now, we're like toddlers stumbling around, bonking our head on a table. We're making mistakes because that's what you do in your infancy. Everything's going wrong. I mean, every company's going out of business, right? Like, what else can I say?
Yeah, there's a lot that we could talk about. From my perspective, I think it's people raising a lot of money and building a lot of shiny things that underperform because they need to show investors that they did something worthwhile with that capital. But the reality is that they're scrambling now to sell through the product that is of poor quality in unmanaged environmental areas that now is causing deficits. And with those deficits come cutting corners when it comes to your extracts and when it comes to your plants as well. And I think that, a lot of ego has been infused into the sector that is of negative consequences. And I think that, companies have not truly looked themselves in the mirror to understand what their purpose and their passion is for being in the space, and then what their niche is, what their competitive differentiator is to motivate a patient to buy their product or to be served by their product over their competitors. And it's really business 101. Again, a lot of folks jumping in really quickly with a lot of money, burning it to shareholders' dismay, and then trying to recover, which creates inconsistencies within that business model and high turnover from your employees to your actual facilities, and none of that benefits any medical program or adult use over-the-counter program.
People think it's going to be easy. This is not an easy industry. There is no easy way to make money, and so a lot of people get in, get chewed up, get spit out, and leave. So I will say that I want to just raise the people up like Bob, like David, the ones that are still here. Kudos to you.
So,
Rob,
and Guile,
Rob's a
another
legend.
question?
Sure. Is there another question? Oh, there you go. We'll go here and then we'll go there.
Hi, thanks very much for a very informative panel. I'm kind of curious because I come from a North American perspective, but I've lived in Portugal for the last year now. So I've really started to integrate a lot, and I've been in the industry in North America since 2009. So there's definitely been a stronger focus on medical here. But we've also seen in North America that a lot of the quality and the innovation comes from the legacy market, comes from the craft growers. And I guess there's this underlying fear that I have that this focus on big pharma taking over the industry will stifle the small grower and in turn a lot of the innovation that we see from the plant. Germany's model with forcing the different social clubs to grow their own product could mitigate that to a large degree. But if we're looking at a broader European pharmaceutical model, do you think that there are ways to ameliorate this before we, run headfirst into the train?
Real quick, our perspective on the pharma getting into this industry is it's probably not going to happen. If you look at pharma, well, it's going to happen, but not to the, I think people think it is, because if you really look at pharma, what's happened, so the sandwich facility, which was responsible for Lipitor for Pfizer. Pfizer sold that off like 20 years ago, 15 years ago. Pharma companies have been kicking off innovation. They've been getting it from biotech companies, right? And the problem too with pharma companies, they're always looking for composition matter coverage on molecules. To get that in these natural molecules is pretty hard. So essentially the pharma companies, and we know, we've talked to Pfizer, Novartis, Lilly, AbbVie, you name it. GP has talked to those groups. I know Barbara Dalton at Pfizer Ventures, they still supposedly say they're not interested. I believe they are. But I think the other thing is, frankly, that pharma companies come from a biotech guy, and I'm sure there might be some pharma company people in here, but I think we're going to be seeing more interest in biotech than pharma in the industry.
I would say that they're not the same industry. A pharmaceutical company is never going to own a dispensary. They don't want anything to do with it. It's not the same industry. The innovation that you talk about from the illicit or the legacy market, that's for consumers that purchase cannabis over the counter. A dispensary is merely an over-the-counter dispensary access conduit. It has nothing to do with FDA-type approved formulations for specific conditions. So pharmaceutical companies may own that. They will own that necessarily because it's a lengthy process that requires approvals, clinical trials, IP protection, and the like. But a pharmaceutical company is never going to have anything to do with the dispensary. Not here, not anywhere in the world. Ultimately, those models have to merge. So that's why I say I don't think pharmacy is not going to own this. Pharmacy is going to own what they own, but that's very different than OTC cannabis, which is what a dispensary is. That's all it is.
I think it's I don't know that they necessarily have to merge, but they have to coexist because there's two different models. One is you go to the pharmacy because you want the cannabinoid as an ingredient in something you're taking for an effect. The person that wants to smoke craft cannabis that goes as an over-the-counter purchaser, they are the ones like I go into the wine terroir, sorry about another alcohol analogy, but the people that are really enjoying cannabis socially, that go and they buy, do they want Merlot? Do they want Sauvignon Blanc? Those are the people that really want that craft cannabis. And I think both of those models can exist and will exist because you're going to have flower smokers and you're going to have people that want to take a pill and go to sleep. And they're two different consumers. Well, it could be the same consumer, but they're two different experiences.
And Guy, do we have a time for?
This question that was just asked is a nice setup for what I was trying to understand. By the way, my name is Bernie Sucher, and I'm with Essence Investment, which is a cannabis holding based in Switzerland. I liked very much, David, your nomenclature for cannabis, and it clarifies things very nicely. But I was wondering if the panel could, using that nomenclature, look forward a little bit and kind of map the supply chain that you and Bob both referenced. What are we going to be looking at if we follow that logic from that nomenclature, and what are the business models that, as an investor and as advisors, you see developing? It suggests that, at least from my first glance, that most of the capital in North America certainly has gone into the wrong kind of business model.
Rob?
Yeah, absolutely. So I think that going back to my comment previous, for culture versus commercialization, when I look at a plant, I look at an ingredient delivery system. I look at a widget that can manufacture compounds that I can then isolate to formulate new therapeutic cannaceuticals, where the illicit culture grower, the protector of the plant, sees something that they whisper to and that is sacred. And frankly, that's just not the case. So what we need to do is look at intentional cultivation and crop steering strategies in order to manifest certain compounds out of these cultivars that are chemotypic, as opposed to looking at the color or the aroma. Now, I'm not saying terpenes aren't important. We all know the ensemble effect, not necessarily the entourage effect, of synergistic compounds. We've seen it done in over-the-counter and in prescription medication. But in going back to the previous question as well, I think that, pharma is very successful because they start with the patient and work their way back. Cannabis starts with the plant and works their way forward. And so it's not really the same process, and because of that, it's falling short in delivering true value in a medicinal aspect. So I think that in terms of the optics and how you look at a process, to give a guarantee for the lifetime of the payback over the patient, over the investor, over the physician, and over that relationship, it needs to start with the patient first and not necessarily with the plant going forward.
I couldn't agree more. And one of the things I've said repeatedly is we are seeing this explosion of marketing, bliss, sleep, calm, because the marketing people recognize when they do their consumer research, the people are buying the effect that they want. But it's disingenuous if you start with the patient first. You might smoke weed that makes you horny. It might put me to sleep because we have a different endocannabinoid system, and that is a fact. So the reality...
Because you're a woman.
Well, then there's that on top of it, right? I always use that because I think a lot of men buy cannabis that says bliss because they're hoping they give it to their woman and something will change. But we're buying an effect, and we cannot deliver that effect where every one of us takes ibuprofen and it gets rid of our headache. That doesn't work like that with just the plant. So if we start with the patient forward, what we really need is individualized medicine because cannabinoids are individualized, or you have to use the ingredients in a way that you can deliver that consistent effect. Right now, we haven't figured it out. It goes back to the lab testing. It goes back to knowing what we're doing. Like you say, it's biotech. We're going to get that innovation from biotech. But I will really, maybe I'll, in the history annals, 100 years from now, they're going to say I'm an idiot. But I really honestly think that consumer that loves the experience of smoking purple flower or the smell of limonene, that's not going away either. We know that the majority of people who smoke cannabis smoke flower. It's still the biggest percentage of the industry. But I think in terms of making money for investors, we've got to be looking more at the pharmaceutical model. So Bernie, to answer your question, I don't know that there's a right answer for how supply chain is going to work, but I think if Rob's point is accurate, and if in North America where we got to be shot out of the cannon, had we chosen a pharmaceutical model, we would have happier investors today.
Two things real quick. With regards to the supply chain, I think anybody would agree that knows cannabis, whether it's a phytosource or a synthetic or chemistry or whatever, the method that produces the highest quality molecule at the cheapest price is going to win out, whatever that is. And actually, if you guys stick around, we have a panel this afternoon on science and one on cultivation, where it's going to be cultivated. I think we're going to answer both those. One last thing is, to Jamie's point, there's a lot of genetics aspects to this that we really haven't looked into because everybody metabolizes these molecules differently. And my wife will be the first one to tell you. But I think we're almost out of time. But Bob, did you have any closing comments?
Do we have time? What's the future hold as I see it? Formulations are formulations. Supply chain-wise, cannabinoids, the plant is a treasure trove of ingredients. If you think of it that way, it's a treasure trove of ingredients. What you take off of the plant and you put into a formulation, that's the supply chain. So how does that transition into the pharmaceutical world? Well, that's formulations based on specific conditions, run through clinical trial processes, which are available in multiple countries around the world. When you look at over-the-counter cannabis, which again is sort of that current European medical model, it's not sustainable because it doesn't jive with ultimately FDA standards and where the FDA is going to go with this, unfortunately. And I'm not saying the FDA is a great agency, but it's an agency that unfortunately is lauded around the world, and its standards will have influence on how this shakes out going forward. So from an FDA standpoint, it's going to be isolated compounds, created formulations, and those formulations from a pharmaceutical perspective will treat conditions. Over-the-counter cannabis supply chain, that relies on flower and extracts from that flower and what's the future hold? I mean, we saw Germany's sort of reversal of course with the adult use program, focusing more on medical. That's actually an interesting thing because you never really needed adult use. You needed a more liberal medical model that masqueraded as an adult use program because of over-the-counter flower. When Colorado, as an example, had 100,000 patients registered, it became a commercial adult use system, even though it was called a medical system, because it had a severe pain catch-all clause. That is a quasi-adult use system. That, from an investment perspective, is what's happening in Europe. So instead of saying, let's go open up adult use dispensaries and supply chain across Germany and across Europe, they're saying, well, no, let's invest in the medical model and create a looser medical model because it's really not a medical model, it's over-the-counter cannabis model, whereas the medical model is a formulation model. That's not the end-all be-all, but that's my perspective on it.
Well, the medical model allows them to skirt the EU rules and put cannabis into the world because, right, you have a social club, you have 500 patients, you're growing for them, patients, and then I go buy my 25 grams of cannabis and I go sell it to my buddy because that's what's actually going to happen. I mean, we know this from the Colorado model. The minute you have all of these social clubs open up, you basically, and by the way, they also decriminalize possession, which means now I can sell you, or, you know, the selling is illegal, but we know it's going to happen, right? I'm going to sell you my lighter and give you cannabis with it. That's what we also saw going on in Oregon and everywhere else, for sure.
Do we have time? Or
I have much more one comment regarding, we are discussing currently the recreational medical way, but what I'm missing is that we have a lack of knowledge about the plant. And as long as we are not solving this knowledge and understanding how do we stabilize the genome of the plant, how do we stabilize our production that we have batch consistency, how we are defining what are our lead compounds inside of the cannabis, we will never come to a way that we have really a standardized, reproducible product. And as long as we are not stabilizing these ones, we are running in the situation that we have a product which does not fulfill what the market wants to see.
That work is actually being done. You probably know the most about that, but we absolutely have that now.
We're definitely starting to see it on a more macro scale, which is very refreshing because right now businesses need to be more focused on what their brand benefit ladder is. Starting with your product attribute, from there what the patient benefit is, and then from there what the product benefit is, and then the emotional benefit. And so if we actually start to look at honing in on those 4 different levels of the brand benefit ladder, and then in terms of intentional cultivation and crop steering, environmental management, ag tech and data analytics, these need to be valued in business plans, and they are starting to do so because it's no longer acceptable for someone to anecdotally say how therapeutically effective this may be. Patients need medicine that is predictable, that is measurable, that is convenient, that they want to take. Patient compliance on these products is very important too. We've seen it in pharmaceutical models, which is why we have flavonoids, which is why we have different form factors for people to be able to achieve the therapeutic results that they want. Cannabis is now starting to embrace it because they're realizing, especially in markets like Colorado, that's very, very old, or Washington and California, those models are drying up and they're not as attractive for investment. They're not as attractive for scalability. And so they're now starting to pay attention to that. And some of our newer models, like in Pennsylvania, where they had a clinical registrant license, where you partnered with a university, we're seeing academia start to embrace more in the research and the development of these products as well, unafraid of federal prosecution or lack of funding, which is where we're starting to see that opportunity gap filled.
And you're absolutely right that this gets back to my original point about the biological supply chain does not get enough respect. So for example, if you really know about cannabis, it is very dependent on all kinds of grow conditions, CO2, temperature, moisture, humidity, more than that, right? It's a very sensitive plant, which if you vary any of those, you can have a different terpene and cannabinoid profile. The other thing that's interesting, if you know Jeff Raber, who's one of the leading chemists in the world out of Southern California, he's done tests where you take the same chemovar, cultivar, whatever you want to call it, and concentrate it down in 2 different processes, same process, whether it's ethanol, butane, and you end up getting different ratios of the cannabinoids and terpenes with the same chemovar. So this gets back to my original thing that I've been saying for years. when people are trying to establish brands, brands are built on consistent quality, right? That's what Coke made their name on. And as your point brings up, it's hard to have a very good brand when you can't control the consistency and the quality of what you're doing. There's not enough respect, and you have a good point. That's what we need to do.
It's interesting. We're talking about pharmaceuticals. What's blowing my mind in the U.S. right now, and also in Europe, is this legal THC coming out of hemp, and that goes back to Bob's point that you can grow hemp for $600 an acre. And if you do that and you are extracting things from the plant, then you can formulate those molecules exactly the same every single time. So when we start seeing the legal THC coming out of hemp, I think we're going to see an explosion of the university testing and all the things that we need to have that consistency for the brand's sake.
The only thing I was going to say is this is not my perspective, but this is a perspective of many of my clients. Dare I say the plants don't matter? What I mean by that, I'm not saying that. That's what I'm saying. What I'm saying is the composition of the plant doesn't matter because you're extracting a compound, you're isolating it, and you're creating formulations based thereon. It doesn't matter what plant those compounds come from. This isn't my perspective. This is something that's prevalent. So I'm not saying the plant doesn't matter, but that's the future. Is all I need is an isolated kilo or liter of CBN, CBG, CBD, and then I create a formulation based thereon. That is unfortunately, I think, the future.
Okay.
Gaio, do you have a question?
Yes, I do have a question. My question is, so you're saying the future is just pills and chemicals and extractions, and the future is not the plants?
On the pharma side, not the over-the-counter cannabis
Did you miss the part
side.
where we talked about terroir and...
Yeah, I mean,
okay.
and that's the thing
You're
too.
gonna have both.
And my other thing too was, like, is it possible, like you said, expanding? So you're saying, instead of calling this adult use thing, it's a medical cannabis dispensary, which I think is a great idea. And you can use that. You can use the analytics and the people who buy the things, and you can do surveys. Because I know a lot of people who keep, especially in the early days, who kept like a weed journal. Oh, I smoked Blue Dream, and this is how it made me feel. And I smoked OG Kush, and this is how I felt about it. And you can use analytics to really get a feel for it. And the problem, of course, and we've all talked about it, is a different, the same strain will affect two different people differently. And also you give two growers the same cultivar, and you will get two different results just because of all the things. So I think sometimes we have to leave space for magic and not always rely on
this is how we got here.
On
right?
strictness.
And this is how we got here.
So, anyway, if you have a few more closing things, we'll go to the second panel. But thank you. That's a good point. And I understand it too, especially here in Germany where everything must be so. You have
Noch eine Frage.
Oh no, I guess we're out of time.
Yeah, we're out of time.
Oh man, that was fast. Let's hear it again for our fantastic panel. David
Thank you,
Trailer,
guys.
Rob
Thank you,
McAvoy,
everyone.
Jamie Pearson, Robert Hoban.